This is the video on anxiety. Anxiety is something we all feel from time to time. An anxiety disorder is present when a person has frequent repeated episodes of intense, excessive, or persistent feelings of worry or fear about everyday situations. The anxiety the person feels can be so overwhelming that it interferes with daily activities. The anxiety can become so strong as to cause panic in the person experiencing it. The anxiety can prevent a person from going places and doing things, as it tends to be blown way out of proportion. Some of the more common anxiety disorders are generalized anxiety disorder, or GAD, social anxiety disorder, phobias, and separation anxiety. GAD is when there is a generalized sense of anxiety. There does not seem to be any one thing causing the anxiety. The person is just anxious all the time. It is a generalized state or condition. This is difficult to overcome as there is nothing the person can do to relieve the situation. Social anxiety is being fearful of social settings, such as going to a party or concert with a large number of people in attendance. Phobias range from fear of snakes and spiders to fear of clowns. Separation anxiety is seen in children that are afraid to leave their parents, even to go to school. Some of the symptoms of anxiety include feeling nervous, having a sense of impending doom, rapid heart rates, rapid breathing, sweating, trembling, feeling faint, trouble concentrating, trouble sleeping, stomach problems, and being unable to control the worrying. Most people with anxiety will try to avoid the situations that make them anxious. A panic disorder involves repeated episodes of feeling very anxious that seem to appear suddenly. The attack reaches a peak in a matter of minutes with the full run of fear symptoms: the increased heart rate, rapid breathing, feeling of impending doom, and intense fear. These tend to happen without provocation, leaving the person fearful of when the attack will happen again. People with phobias may have a panic attack when presented with the thing they are phobic about. Trauma is a risk factor for anxiety. If a person has endured trauma or abuse, or even if they witnessed abuse or trauma, they have a higher risk of developing an anxiety disorder than normal. Stressful life situations or a buildup of smaller stressful situations can lead to excessive anxiety. Such events as moving away, working a new job, or death of a family member can lead to anxiety problems. Sometimes, the stress can be over an illness the person has or a loved one has that can cause an anxiety problem. Drug or alcohol problems can exacerbate the anxious feelings. There is no way to predict what will cause someone to develop an anxiety disorder. Treatment for anxiety is typically a two-pronged method: medications and talk therapy. The medications can help the person with feelings of panic and anxiety, and the talk therapy can help to prevent the feelings from overrunning a person's life. The earlier the situation is addressed, the better the results. This ends the video on anxiety.